What I'm going to talk to you about today is healthcare. And the first thing I want to introduce is the idea that healthcare isn't just what happens in the doctor's office. So this graph is kind of showing you, sorry, the text is kind of small. This little gray triangle over here is the amount of clinical care that's attributed to your life expectancy. So that's only 20% of the factors that actually determine your health outcomes is what happens at the doctor's office. So everything else about your life, your job, your income, your housing, your food, is really more influential in your health. So whether you're eating an unhealthy diet or you're avoiding care because of the cost, because of the health care bills, or if you don't have reliable transportation to get to appointments, all of these unaddressed issues lead to reactionary care, emergency department use, which is really expensive, and you've obviously already had a really serious health issues to land in the emergency department. And so typically these things are addressed by social services, and they work in their own silo providing social services, and then healthcare providers are working in their offices providing health services. So to address this, a grant was awarded to 7 regions in the state, and their job was the grant was awarded to local public health agencies, and they were responsible for connecting social services and healthcare providers to really get down to addressing these social determinants of health. So, I know what this looks like, and it looks like some kind of crazy conspiracy theory, but this is one map from one site of these 7 sites in Iowa, and each of the little circles on the map is showing a local organization. So, and the organizations are color-coded. I don't know how well you can see it, but so each of the organizations is color-coded by its sector. So we're looking at how different systems are working together. You've got public health, social services, and healthcare providers all working together here. And the size of the symbols are adjusted to show how important they are in the network. So the larger the symbol, the more important, the more entrenched in the network they are. So what is really, so you can see that this is descriptive of what's going on here, and you can see that this group is really densely connected. You can see to the right of them, there's more organizations in the network, but they're not really participating in the care coordination as heavily. So what's going on here in this kind of dense clique is healthcare providers are identifying patients that have these social needs, and then public health is connecting them to the social services. They created a database, they're tracking outcomes, and they're really doing this preventative screening and getting this care taken care of before they land in the emergency department. And so the patient impact of this work, of working across systems, is that when they started this intervention, 77% of the patients said that they had problems getting getting transportation to their healthcare visits. And by the end of this, 100% of them said that need had been met. And 0% of them had been in the emergency department in the last 6 months. So really a huge success here. And the policy implication for this is that this is grant funded. So the funding is going to end on Tuesday, actually, at the end of this month. And so a huge part of policy is funding allocation. So whether the state decides that they want to fund local health departments and how much, they're cutting the staff that they had used for this intervention. So that's up to our policymakers. And I'll see you at the poster if you have more questions. Thanks.